Health literacy is a huge problem in the healthcare field, especially in an imaging clinic. There can be several different reasons why there is a health literacy problem, but one example is due to a language barrier. Some of the ways to improve and fix this barrier is to make use of interpreters, give pamphlets that have pictures and diagrams, speak directly to the patient and use sentences that are brief and to the point, and to use the teach-back method. According to the Refugee Health Technical Assistance Center, interpreters can reduce liability, help ensure appropriate utilization, and increase client adherence and satisfaction with services. Interpreters can assure communication between the patient and the provider, support effective use of time during the encounter, and improve outcomes. When choosing an interpreter, it's important to make sure this person is fluent in both English and the other language. There should also be a test to make sure the interpreter is using formal wording instead of slang. This is important because older generations can find slang offensive or may not comprehend it. If they don't know how to speak formally, they shouldn't be hired. The radiographer should speak directly to the patient using brief and to-the-point sentences. Adding more than necessary information could get lost in translation. To save on cost for adding an additional employee to the payroll, it may be a good idea to have the interpreter come in on an appointment-only basis. Because there are online interpreter services available, it'll always be easily accessible for someone with a language barrier to have someone to bridge the gap. The only downfall to this is that an online interpreter can charge $1.50 per minute, which can exceed the imaging clinic's charge for that visit. If the interpreter is there all day, every day, there's a good chance they won't be needed on certain days, and it's not cost-effective for the clinic to pay when work isn't being performed. Handing out pamphlets with pictures and as little wording as possible can also help clear up potential issues. This also helps patients that learn better with pictures rather than hearing or reading. The pamphlet should show how an x-ray is done and what is expected. This can also be coupled with an interpreter, so they can hear what is expected and see it. There should be pamphlets made prior for different procedures, and extras should be kept on hand for common procedures. The radiographer should put these together themselves to guarantee proper directions and pictures are included. The cost of this should stay relatively small since all that needs purchased is the paper and the ink, and it can cut the cost and the time to redo an x-ray. In the article Health Literacy and Patient Preparation and Radiography, they state that patients are almost 4 times more likely to have a good quality colonoscopy exam after receiving educational pamphlets that designed to be easily understood. Studies show that 40 to 80% of medical information patients receive is forgotten immediately, and nearly half the information retained is incorrect. The teach-back method is a way to confirm that they've explained to the patient what they need to know in a manner they understand. With using an interpreter, pamphlets, and the teach-back method, this will assure the radiographer that the patient fully understands what's expected of them. The radiographer will show the patient exactly what they want them to do and have the patient show them the process afterwards. This clears up any confusion as the radiographer can correct the patient and give feedback before they get too far into the process. The teach-back method is one of the most effective methods for understanding a process and is free for the imaging clinic to add into their teaching. When a language barrier exists, it can cause problems for the patient to understand what's expected of them. Interpreters can bridge the gap by telling the patient what's expected of them in their language. Pamphlets can help them understand what's expected due to seeing the process on paper. And the teach-back will make certain that both the radiographer and the patient that the message is given by the radiographer is being received by the patient properly. Using these methods together will improve the health literacy of the patient and make sure the process is being understood.